Hello, I'm Yasmine. First, I would like to thank Sarah Bouhouche for her help and WCAPS for this amazing opportunity. Today, I would like to talk about something we all go through in our life and we all feel almost every day. I would like to talk about pain. Let me give you an example. Imagine I'm playing tennis with friends, and as I'm trying to hit the ball back, as the clumsy person I am, I hit my teammate on the face with the tennis rackets. My teammate starts screaming because she feels pains. Pain is something we share as human beings. It bonds us together through the mechanism of empathy. For example, after hitting my teammate, I'm going to feel bad and sorry for hurting her. I feel empathy. What is interesting is how our vision of pain has changed through time. Today we have great tools, knowledge and effective drugs to relieve people from pain, such as when they are sick, when they hurt themselves, or when a clumsy person hurt them. Although we are all going through pain during our lifetime, to this day we are not equal in terms of how we receive treatment and care. Many studies have shown that white people receive better care when it comes to pain than non-white people. I know that in a pandemic era, this doesn't seem like the biggest problem we are facing right now. But in fact, it is very important because of two main reasons anchored in history explaining the tendency to ignore other people's pain. The first reason is tied to strategy of war or conflict, during which we intend to weaken the enemy by means of weapons or torture, for example. We don't just ignore their pain, we want them to feel it. The second one happens when a group of people doesn't consider another group of people as their equals, when they deny their humanity. We know empathy can be defined as the ability to identify with another person through their feelings. But how could we understand another group of people's feelings if we believe that they are not like us? Well, a good example of this tendency happened when Europeans discovered the New World and its people. I don't know if you've heard of the controversy of Valladolid, but it was a trial that took place in the 16th century in order to discuss if indigenous people were as human as Europeans. Their ability to feel pain was a central part of the discussion. This also happened during slavery. Let's take a closer look. J.Marion Sims, considered today as the father of gynecology, was a physician during the 19th century. He believed, like many others at that time, that black people couldn't feel pain the same way that white people do. He performed gynecological experiments on many enslaved women, such as Lucy, Anarcha, and Betsy, without analgesia. We know he operated on Anarcha 30 times without analgesia. And analgesia is a type of anesthesia. Now, let's pretend Lucy was born in our time, and that she's 28 today and suffers from the same gynecological issue. Let's say she's enrolled in a surgery trial to test a new way to treat her condition. Lucy would give her consent and even be given analgesia this time, but her pain would probably not be treated as well as if she was a white woman. Because she's not a white woman, so it got better, but we are not there yet. There is a lot of literature on this topic from the United States. It's all say the same thing. There are racial disparities in pain management, even toward pediatric patients. Non-white people, and especially black patients, do not receive as much analgesia for the same amount of pain as a white person does. A study has shown in 2009 that if you're black in the United States and have a long bone fracture, you have a 66% chance of not receiving any analgesia compared to your white friend with the same broken bone. And this is just one example. You could spend your day reading about this. Thanks to all this literature, American researchers understand that one of the reasons for these disparities is health providers' false belief toward minorities, and one of the solutions is to improve their education on the topic. It seems manageable, doesn't it? Here, I'm talking about the United States, but I want to make it clear. Racial disparities in pain treatment is not only an American problem. It concerns most Western countries, and this includes France. And the French case is much less documented because the law forbids data collection related to ethnicity or skin color in research, which makes it pretty difficult to assess racial disparities in health. But if you look closely, you can still find articles on what we call the Mediterranean syndrome. This syndrome is a cultural stereotype which states that minority of colors, specifically people from around the Mediterranean basin, exaggerate their symptoms and pain. And although it is rooted in many healthcare workers' practices, this phenomenon is not well documented yet, and it can lead to tragic consequences. But without literature, how could we identify the issues and provide solutions to fix them? Because without data, the issues don't officially exist and nobody knows about it. But when I say nobody, I really mean the decision makers. In 2017, a French young black woman named Naomi Muzanga died after calling the emergency services, complaining of a severe stomachache. The operator mocked her, ignored her pain, and then hung up on her. A few hours later, the young black woman died. This case really shed a light on what is called the Mediterranean syndrome in France and brought up many questions about discrimination in healthcare. Many organizations, physicians, and other practitioners said Naomi was a victim of the Mediterranean syndrome. After Naomi's case, the government promised a new emergency number and mandatory training for the medical regulation assistants. But then nothing happened. Let's go back to Lucy. Since the surgery, she's still very confused about what happened to her. She moved to France, and upon learning about Naomi's case, she realized that maybe what happened to her was something similar to the French Mediterranean syndrome. In August 2020, Lucy hurt her head playing tennis. And needed to see a doctor again. She asked one of her friends if she knew a good one. Her friend gave her a list of black doctors that was published on social media. She thought it would help her in finding a doctor who could treat her correctly. But then, a few days later, the list was all over the media, with articles labeling it as communitarianism. What if instead of accusing these people from communitarianism, we decided to better understand why such a list existed in the first place? Let me tell you a little bit about my own experience as a healthcare provider when I started my career. I used to be a nurse, and during one of my first internships in nursing school, I had to take care of a North African woman. She was complaining a lot about her pain. When we got out of the room, my colleague told me that we needed to be careful because, maybe this North African patient was subject to the Mediterranean syndrome. This was the first time that I heard about such a thing, but it was certainly not the last. I was really shocked, in part because look at me. I have the same North African background than this woman. She could have been my mom. How are you supposed to react when you start a new job? You're an intern and you are facing unconscious racist behaviors from those you are supposed to learn from. After this internship, I had a discussion with my teachers. I was still very confused. They actually explained to me that it is a false belief within the sector. It's not something you learn at school, but in the field. Now, please don't get me wrong. Most of these healthcare workers, my colleagues, do incredible work under very difficult circumstances, but we must help them do better. In school, we don't hear about this syndrome at all, and this is maybe where the problem lies. Maybe we need to talk about it and learn about these false beliefs so that we are able to deconstruct them and prevent these biases to affect the quality of care toward non-white patients. Despite the lack of scientific literature on the topic, blog, videos, and social media pages are talking about it a lot. Healthcare providers as well. Maybe it is time to listen to them. The government must get involved in tackling discrimination and racism in the health system. We need to reform the way we educate our healthcare providers so we don't have other Naomis. But this won't happen without an appropriate setup policy. As human beings, we are empathic by nature. As healthcare providers, we want to relieve people's pain. That's what we do. Let's do it for everyone, equally. Let's face racial bias in pain management in France and abroad so we can tackle it. Thank you.